Welcome to this webinar that will look at identifying and managing return to work barriers with a consistent, systematic method using the return to work flowchart. As mentioned in a previous webinar in this series, the evidence suggests that returning to work is good for our health and well-being. And being off work for prolonged periods is biopsychosocially harmful, and that the longer someone is off work, the chance of ever getting back to work diminish. If this is the case, then why don't people return to work sooner or at all after an injury? There are many factors that can impede an early, safe and durable return to work. These can include the patient, the employer, the certifier, the pathology, or employment. A consistent approach is required to effectively identify and then manage the return to work barriers. The first question that must always be asked is, how is the injured worker certified? To then quickly establish why someone is not back at work and what needs to be done to address or facilitate a return to work. The following return to work flowchart was developed as part of WorkSafe Victoria and TAC's occupational physiotherapy program. For the purpose of this webinar series, we will focus on the right-hand side of the flowchart where someone is not at work, and then looking at systematically identifying and managing the return to work barrier. The flowchart also considers factors that may be within or beyond the scope of a physiotherapist to influence. The first part of the flowchart indicates that return to work should be considered from day one and ongoing, and managed with a sense of urgency. As noted earlier, with more time elapsing, the more challenging it is to facilitate return to work, and the adverse effects of being off work can escalate. If your patient is not working, then follow the flowchart below. The first question asked is, how is the patient certified? If the patient is certified fit, then the barrier relates to employment, i.e. they're not job attached or the employer is unable or unwilling to provide suitable duties that match the certified restrictions. Management of this barrier will require vocational type intervention. There are a number of things you can do to assist that would be within your scope. If the patient is job attached, consider liaising with the employer or undertake a worksite visit. There is a billable item on the fee schedule for physiotherapists to use to undertake a worksite visit. Liaising with the occupational or vocational rehabilitation provider could also assist. Although assisting in job seeking would not be within the scope of physiotherapists, providing treatment that focuses on improving function is critical, as improved capacity can result in improved employability. If the patient is certified as no capacity for employment, the next question is the incapacity medically necessary? Being certified no capacity for employment is medically necessary. The barrier is the pathology. It's of a nature or severity that work or activity will delay recovery and may harm the patient, others, or equipment. Please refer to the relevant webinar in this series on further information regarding medically necessary incapacity. In this situation, the management relates to the pathology. It is within the scope of a physiotherapist to set expectations for when the condition will improve, to then be certified with some capacity. Finally, if the patient is certified no capacity for employment and is not medically necessary, then the return to work barrier is the certifier. It is within the scope of a physiotherapist to assist in appropriate certification. If it's been identified that the certifier is the barrier, the first trait to consider is whether you are able or willing to issue a certificate. If you're the certifier, you will need to review the appropriateness of your certification and adjust this accordingly. If you're not the certifier, it may be reasonable to contact the certifier and offer to assist in issuing ongoing certificates. If the certifier wishes to continue issuing certificates, then discussing appropriate certification will be beneficial. If the certifier continues to issue certificates indicating no capacity for employment, and it's not medically necessary despite your communication, it may be beyond your scope to continue with this and seek assistance from the agent and their resources, such as return to work specialists, medical advisors, independent medical examiners, and occupational and vocational rehabilitation services. If the certificate is changed to demonstrate some capacity, the next step is to see if the person returns to work and then managed accordingly. The return to work flowchart allows a systematic and consistent approach to identifying and managing return to work barriers. It uses the certificate of capacity as the basis for decision making. In summary, there are essentially 3 return to work barriers. Firstly, if your patient is not working and they're certified fit, then the barrier relates to the employer or employment. This can be primarily managed with vocational type services. Secondly, if your patient is not working, they are certified no capacity for employment and it is medically necessary. The nature and/or severity of the injury is the barrier. This can be primarily managed with clinical type services. Thirdly, and the barrier that is counted more commonly, if your patient is not working, they are certified no capacity for employment and it is not medically necessary. The certifier is the barrier. This can be primarily managed with certifier influencing strategies. A certifier can be influenced directly or indirectly. Direct methods include discussing with the certifier or issuing the certificate yourself. Indirect methods including communicating with the certifier with a letter, a fax, or an email. Alternatively, discussing appropriate certification with the patient who can then discuss with the certifier can be a very effective strategy. When engaging the certifier, it is important to put first things first. In other words, discuss the certified capacity first and foremost rather than the return to work first. This will then ensure that certification should consider capacity rather than be confounded with other factors that do not directly relate to the injury or capacity. We hope you enjoyed this webinar and you've had a look at the others in this series. Remember that due to the physical, psychological, and social benefits, we really should see return to work as treatment rather than a goal of treatment.